So, thank you very much for joining the session tonight. Today, we will talk about how we can use data and analytics to improve services in terms of quality, efficiency in the healthcare industries. Okay, so next, before we start, we would like to also give an introduction here about the certification. If you guys want to build up your credentials and you're interested to have a certificate of participation, please send us an email at info@houseofanalytics.com. Don't worry, we will also send this email at the chat panel later at the end of this session. Okay, so for those of you who just joined tonight and you guys haven't been previously exposed to House of Analytics, we would like to introduce ourselves first. Okay, so who is House of Analytics? So actually, House of Analytics, we are an innovation consultancy. We are based in Jakarta, and we help companies understand their problems, their needs, and we give them innovative recommendations to move forward. So moving ideas forward, make it happen. In terms of what we do, we use an experiential method. So what is experiential method? Experiential method is where we try to solve problems. We combine data with also field observation to gain insights and to provide better and also faster decisions. So if we see our project portfolio is very, very diverse, right? So it's not just financial industries, but we also engage with education, with logistics, with retail, and also with NGO. Very diverse. And if you have previously been through our webinars, we also talked about a lot on, if I remember, 2 weeks ago, we talked about building analytics team where we help organizations realize that actually they can groom their talent by giving them projects. So it's like a trial experiment where organizations are able to groom their talent by giving them the opportunity of empowerment. And other projects are also really, really interesting, where we try to help organizations optimize how they manage their financials, which we have talked about previously in our session, in the value of business analytics in financial decision making. And you can also check all of those materials in our YouTube channel at House of Analytics. Okay, so if we go through again next, right? So tonight, who will be the main speaker, right? So tonight, Sarah will be the main speaker, and then followed by Sean. I'm going to introduce Sarah first. So hi, Sarah.
Hi, Tasha.
Thank you very much for being the main speaker tonight. So I would like to ask you, right? What is it about your background that you want to talk about more on healthcare industry for tonight?
Okay, so thank you, Tasha, for the quick introduction. My name is Sarah. I have been working together with Sean and Tasha in House of Analytics for almost a year now. And my background, I used to study dentistry for my bachelor degree. But however, I also have different experiences in businesses or financial or human capital analytics.
Thank you very much, Sarah. So Sean, hi Sean, would you like to introduce yourself?
Yep. Hi, everyone. So my name is Sean Taher. I'm one of the co-founder of House of Analytics together with Tasha. And basically, my background is mostly in business and finance, where I did economics as well as innovation management during university time. And most of my skill set as well as my strengths are in the conceptualizing as well as problem framing. And I've been mostly working in banking for most of the projects, as well as in um, multi-finance.
Thank you very much, Sean. So let me introduce myself. So tonight I will be the moderator, and my name is Tasha. You can call me Tasha. Tonight I will be moderating Sarah and Sean. My background is mostly on projects related to human capital and also business analytics, where I try to help companies gain insights on how to connect between human capital and also business analytics in order to improve their business strategy. So that's where tonight I will also ask Sean and also Sarah to be able to provide insights. What is it about business analytics or human capital analytics, and how this can help the healthcare industry improve the efficiency and also improve the quality of service. So without further ado, let's start the material for tonight. Okay, so tonight, what to expect, right? So number one, what can you expect? The topic is about the application, of course, of the data and analytics in the healthcare industry. And then we will show examples from our own case study about the problem solving in the healthcare industry and how we can make decisions out of those information. Number three, we will also talk about how we are able to do problem framing, what is the framework, and how it applies to problem solving. What not to expect. So this webinar, we won't talk about healthcare and health sciences topics that are not related to data, analytics, and also problem solving. Number two, we will not talk about diagnosis or diagnostic method in the healthcare industry. And number three, we won't talk about analysis method and also tools that we will use in the healthcare industry. Now, to start the journey, right? So Sarah, since you have a background in dentistry, right? Very interesting, where you deep dive right now in consultancy, and where you can apply your background in dentistry to your consultancy projects. So when we talk about healthcare industry, right? What type of healthcare is actually available out there, and what are the differences?
Okay, so Tasha, so thank you for the question. Actually, there is in this presentation here, you can see that there are actually 4 stages or 4 journey of healthcare. This doesn't diminish that there are also a lot of journey behind, but I'm trying to make it simpler by only presenting 4 of them. The first one is preventive, and then it goes to the curative, rehabilitative, and palliative. And then if we want to see the difference between what is the difference between the first one to the second one, third one, and fourth one. So basically, the difference between them are the purpose of the healthcare. For example, the preventive journey, the first step of healthcare is actually to prevent the pain or to prevent the sickness. And the second step is to cure. So if someone is already sick, then this journey plays a big role that we want to cure them. We want to help them get better. However, some sickness or some disease, even after we cure them, sometimes we need time to heal ourselves. And here comes the fourth step or the fourth journey, which is the rehabilitative, to restore the body from the pain, to make it functional again. And the last stage, if everything else doesn't help, we cannot do anything else, then it comes to the last step, which is palliative care, which is to relieve from the pain. Usually, if I want to give an example, usually these journey can be different compared to one disease to another. If I want to take an example in cancer patients, the preventive part is where we try, or where the cancer patients try to improve the lifestyle, try to improve the health quality and keep themselves healthy in order to not get cancer. And then the second one, if this person or this patient still get the cancer, then the curative part here comes when they try to do surgery and radiation therapy in order to cure their cancer, in order to get rid of the sickness. However, after the surgery, we need time to heal. We need time to be able to get back to normal function. So rehabilitative part comes where we try ourselves, we try to train ourselves, and we try to help ourselves to be able to work functionally again. So if someone had a cancer surgery on the knee or on the legs, let's say, the rehabilitative part would be the part where they try and learn to be able to walk functionally again, just like before when he had the surgery. However, in some cases, such as in cancer or terminal illness like HIV, cancer, maybe diabetes, and so on and so forth, there comes the last stage, which is the palliative state, where the patient feels like, I'm already in the late stage. I don't feel like I have any more hope, and the doctor said, the cancer is spreading already. I'm in my terminal stage. I just don't want to feel pain anymore. So palliative here means that the healthcare is trying to make you live the best of the rest of your life, to clear the pain from the rest of your life, and also to help your family and whoever close to you to endure the emotional pain as well.
So very, very interesting, right? These four, if I may call these four differences in terms of understanding the journey of the patient, and also in order to, if we can say, improve the quality of the journey. So
Yes, correct.
yeah, so if we were to talk about improving the quality of the journey, right? What type of information do you usually collect in the healthcare industry so that you know, okay, my patient is doing well, my patient is not doing well?
Okay, so for example, let's say you go on a visit to hospital, right? Or you admit yourself to hospital because you have a broken bone or because you have a fever, so on and so forth. So of course, the first thing that they ask you is, what is your name? Who are you with? What is your age? All this data is something that we call as patient's demographic. This data also helps us to determine what kind of treatment that would suit you best. And of course, we would also like to measure your height, your weight, your blood type, your blood pressure, and so on and so forth, and your medical history. All these data are commonly taken. Even if you're not going to hospital, maybe you're just going for checkup or buying drugs from the pharmacy or the apothecary, usually they would also take a look at all these stuffs, like, oh, have you ever been hospitalized before? What kind of sickness that you had before? Have you ever had a surgery before? And so on and so forth. And they would also ask you about the allergies. all this happened even before you met the doctor or the nurse, when you were in the administration table. And when you finally get called into the room, like the doctor or the dentist or the nurse calls you in, they would ask about, how are you feeling? What is your complaint? Why are you here, basically? Like, oh, I'm feeling a fever, let's say. And then they would ask, does this fever comes with anything else? The symptoms of the fever? Do you have any cough? Do you have any flu? And so on and so forth. And what happens before the symptoms happen? All of these are related to the pain activity or the pain level. And you would also be asked about the pain level and whereabouts. Like, if you ever went to the doctor because you have a stomach ache, they would ask, how do you feel? What kind of pain is this? Does it feel like someone crunching your stomach or someone pointing a needles to your stomach? And where is it? Is it on the left, on the right, or so on and so forth? And if needed, you would also be asked about your X-ray result. So if you take a medical X-ray, they would ask, or they would refer you, so that the doctor or the dentist or the healthcare worker can have a better illustration on what you're currently experiencing or what happened in your body. The point here that I would like to emphasize is that the patient complaints until the X-ray results usually and commonly are used for diagnostic purposes. So doctors, dentists, nurses, and everyone who works in the healthcare, they would ask all of these, the patient's complaint until the X-ray result, to help them diagnose what is it that you're currently feeling, and then to help them prescribe a drug for you if you need it, or give you a recommendation what to do so you won't feel the sickness or the pain anymore.
I see. Okay. So these are the what we say are the things that people usually track and monitor in the healthcare industry, right? So if
Yes.
we go to your case study, which you and also Sean has gone through, what kind of challenges do you encounter in terms of uh, consolidating all of those informations into insights? So Sean, can you share more about how did you do it? How did you gather the insights?
So one of the challenges that we had when in the healthcare industry is not necessarily in trying to cure or trying to treat the patient, because like what Sarah has said or mentioned in the previous slide, when it comes to medicine, right, it's already data oriented, right? They do a lot of testing. They have to do the diagnostics tests based on different methods, right, to ensure that the patient has this disease or problem, right? But what we're mostly working with is when it comes to hospital, right, and as well when it comes to the quality of care, it usually gets quite difficult when trying to frame these questions or problem, because how do you even measure a service quality in a hospital? Because a lot of people think that when you go to a hospital, you tend to think about how good the doctors are, how smart they are, how they have the best technology, for example, or they have all the different tests available. But sometimes a lot of hospitals don't really think about how can you actually improve the quality and the engagement with the customer. And yes, even though the hospital's main objective is to treat the patient, right, with their symptoms or illnesses, but at the same time, this is where a lot of hospitals get a lot of challenges as well, because they have a lot of data, right? The patient's data, they have a lot of information on when did they come in, how often did they come in, did they, get discharged or not? But they usually have a problem when trying to translate all of those data when it comes to um, improving the satisfaction of the customer. What I mean by this is because um, sure, you can see how good your doctors are, right? And usually the data that you use to measure whether you've healed many patients or not, those are quite clear metrics and data. But when it comes to knowing, how friendly your nurses are, how satisfied your customers are or your patients, how can you make them more comfortable? How can you improve the patient's family, surroundings? Because you also have visitors who are visiting the patients, right? And those kind of decision making tend to be way more ambiguous, and it's the data that you choose may not be as clear as finding out whether you are a good hospital or not in treating patients. So a lot of the challenges nowadays, especially for the COVID-19, right? Knowing that there isn't a cure yet or a vaccine, we only know how to treat the symptoms, right? But at the same time, treating the symptoms mean that you also need to think about how do they feel, right? How do you manage all the beds? How do you even, ensure that everyone gets, was it the treatment equally, right? So it deals a lot with the logistics, but also you also have to think about how do the patients even feel, right? So that's what a lot of the challenges are when it comes to the data analytics part in the healthcare industry.
I see. So it's not just to see whether the patient is in good condition or not, but it also means that we need to also see their overall well-being. Means that their
Yes.
emotion, and also we need to have an empathy on what do they think, what do they feel. So that sort of challenges. I see.
Correct.
Okay, so
Because
yeah.
you can't really, sorry to cut off, but it's because that you can't really measure that, right? And usually you need to find a proxy for it, which is very difficult, of course.
What do you mean by proxy here? Can you explain a bit more on proxy?
So what I mean by proxy is, let's say you want to measure a patient's happiness, right? Just because the patient is healed doesn't mean that he or she is satisfied with the quality of the hospital's care. They might get angry with the hospital's, bureaucracy, the time that it takes to fill in the papers, and maybe the time they have to wait to get a bed, for example. So those kind of data, right? Usually you have to use a proxy, meaning that you need to find another data to show and to basically say that usually patients get unhappy if they have to wait longer, right? And the patient's wait time can then be used as a proxy, as a way to measure whether your patients are happy or not. So it's basically using another data to represent, like for example, the customer happiness, right? Instead of just using customer survey. If they're using customer survey, that's not a proxy. That's a direct, data to show whether your customers are happy or not. But that can also lead to biasness, and it can also lead to, dishonesty. But again, nothing is perfect when it comes to, for the quality of service measurement.
I see. So a proxy is that you're trying to construct a meaning by consolidating different types of data that you say when you talk about happiness, it means that you have collected the customer survey and you have collected, let's say, the survey on the time for the customers to fill in, it's fast. It means that the customers are happy. So we add another data point to consolidate that and say that, yes, the customer is happy. That's very interesting. So if we can talk about the lessons that you have learned, right, from your project with Sarah, dealing with palliative care. What is so interesting about palliative care, and can you explain a bit more on the impact of palliative care and what did you do in the project?
So when we did the project with an NGO that deals with palliative care, especially with children, one of the objectives that we wanted to do was how do they measure the patient's welfare? Meaning that in palliative care, as Sarah has also mentioned, it's about dealing with the patient's condition, right? As well as pain when they have a terminal illness. So terminal illness is basically when the doctor gives a prognosis as well as gives a, kind of like you have a, 3 years to live, for example, right? So when the doctor says that you have a terminal illness, it basically means that you have a duration where, it's definitely you're going to pass away in, a certain amount of time, right? And knowing that what palliative care does is then, it's to make them happier, right? And to reduce their pain, because cancer is quite painful, and then HIV is also quite painful, right? We have to deal with the symptoms. And so here, we're not trying to cure the person. We're not trying to, get rid of his or her illness. What we're trying to do is we're trying to make his or her life much more meaningful. And we're trying to improve the service as well, but not just the service, but also trying to really help the patient in terms of reducing the pain and actually making them happier, right? But the question is, how do we know that the patient is happier or not when we're actually there? How do we know that we're actually reducing the pain of the patient, right? So those are the questions that we had during this project. And it wasn't that straightforward because yes, the organization had a survey that they give to the patient every time they visit. They had a survey asking, are you okay? Are you sad? Are you being depressed right now? Do you feel any pain? But the issue with that was the patient was sometimes can't respond, or at the same time because some of them were in coma, right? And those are quite difficult because how do you then know you're doing a good job or not? And so we had to dig around and figure out what are the data that we can use to say that our nurses are actually making the patients happier or not. And it was a very big challenge, and we had to go to the field as well. We had to visit the nurses, and we had to even visit the patients with the nurses so that we can see how they interact, how do they take care of the patients in different situations. We also had to see them when they were in a coma state. So it was quite an experience to do this project. So a lot of emotions was involved. But nevertheless, we figured out a way to do this. But honestly, the problem wasn't more about the data. It was actually trying to connect how do we actually measure and how do we actually see whether they're happy or not.
Interesting. So you mentioned about you also did an interview with the nurses, right? So what kind of information did you try to collect in order to gain insights, right? You said that the data is not the problem, but it's more on the translating that into insights, and you also did some field observation. So can you uh, tell us a bit more on the field observation? What are the informations that you're trying to get from the nurses?
So when it comes to the data, they have a lot of data. They have the medical records of the patients. They know what the patient's taking when it comes to the medicine. They know what are the treatments, the therapy as well. How many times did they go to the hospital as well? And then they also have data on the kinds of symptoms that they are experiencing. So when it comes to data, they have a lot. But because we are here not to cure them, right? We're here to measure how, how is this organization making the patient's lives more meaningful and happier. We really had to interview the nurses in action because we wanted to get their point of view. And why was this important was because first they were the ones who are involved the most, right? And secondly, they're the ones who are actually experiencing, the emotions, right? As well, they're the ones who can tell us the process of all of the interaction. And what we were trying to get was that if I was the nurse, right, um, what do I usually see when the patients are improving? What do I usually feel, and as well as what do I usually, uh, you know, um, find when the patient is improving or not improving? And so from there, we kind of try to find the correlation between the nurse's interview, right, as well as from the patient's point of view. And at the same time, we also try to connect with the family, looking at how did the family react, right? Because the nurses aren't there only for the patient; it's also there for the family. And I mean, you can imagine if you have a son or a daughter, and they're very young, and you have to bear the burden, knowing that your child is actually going to live on only for three years, right? So we had to get the full picture to know what was actually important in palliative care. And after we did the field visit, um, only then we were able to understand, okay, we can't really look at the medicinal data. We can't really look at the symptoms, right? Yes, we eventually did use the symptoms to see it, but then we realized that it's more about the interactions and the behaviors that is actually more important. Right? We do understand that it's very hard to see whether they're happy or not, but the interaction and how long the nurses are interacting, how deep they develop the relationship with the patient and their family, those are actually the important parts of the palliative care journey, as well as in the NGO.
I see. I like the fact that you go beyond the extra mile in order to understand the journey of the palliative care. Now, I would like to ask Sarah, right, to deep dive a bit more on the result of this case study. So Sean has mentioned that you guys gathered a lot of data, and you guys also did interviews with the nurses and able to have an understanding on the journey of the palliative care, especially from the patient's perspective. Can you share, Sarah, on how did the result came about? What did you find?
Okay, so after we did all the interview with the nurses, we also take a look at the data that this NGO already have in their possession. So basically, what we are trying to see is that we're trying to see whether the patients are happy with the service provided, are the patient's quality of life improve after they get the treatment from the nurses or the visits of the nurses, but we also want to see whether this kind of thing or this kind of service is sustainable or not. Since Sean mentioned before that this is a palliative care organization, and their purpose is not only to cure the patient, not to cure the patient anymore, but also to improve their quality of life and live happily. So this NGO, not only they provide nurses to take care of the patients or they provide medicine that they need, this NGO also try to provide the family or the patients financially. So they pay for sometimes they pay for the drugs, sometimes they pay for the doctor, sometimes they pay for the things that we think that at first it's not really related to the healthcare, but it's actually can improve the happiness level of the patient, such as buying them cake during their birthday for the children patients and so on and so forth. So basically the analysis that we did for them has three major concepts. The first one is the interaction analysis. We want to see what did the caretaker or the nurses do during the period of engagement. How many home visits they do for this particular patients. How many control. Do they accompany the patients to their doctor or not? Do they accompany the patient to call their doctor, or is there any emergency visit apart from the regular visit, and so on and so forth. The second one is the impact analysis. We want to see that whether the patients are feeling better after the care treatment. What are they feeling before the nurses came to their house, and what happened after that? Are they well-being improved or not? Do they still have the same symptoms or not? How do they feel? What are the symptoms they're feeling, or and so on and so forth. And the third one is the financial life cycle. Because that this is a non-profit NGO, which is so because this is a non-profit organization, we want to know how much does the nurse spend for a patient in a year, to see whether this organization are sustainable or not. If we were to ask for a bigger organization or bigger company to donate, how much we are willing to spend for the patient and nurses, because we of course they also have to pay the nurses and the doctor and for the medicine and so on and so forth. That's why we're trying to see how much does the nurse or the caretaker spend for a patient in a year. So these three analyses actually the core or the things that we did for them using their current data.
I see. So if you were to share on, these are the analyses were taken from the data perspective, right? How did the interview perspective came inside these analyses, and how did you consolidate those informations into insights?
Okay, so when we did interview the nurses about what happened during their period of visit, they mentioned that, okay, so, sometimes we feel that the patients are in pain, so we give them free meds, or we feel that the patients are not really eating well because they don't like the food they're being served at home, but at the same time, the patient doesn't really have enough financial capacity to buy food they like. So the nurses also mentioned that a lot of them spend more time or spend more budget on the patient to keep them happy and to increase their well-being. So here we see that the purpose of the palliative care and the goal for the people here, including the nurses and the whole organization, is to increase the well-being of the patients. Therefore, we would like to see whether we can we can improve the efficiency of their work, not only for their current patient, but for their future patient. So what we did is we tried to create a segmentation for the patients. For example, here that we have patient A, B, C, D, and then we make variables for them. The first one is the high severity, whether this patient is in their terminal stage or not, and then the primary therapy, do they currently doing a primary therapy from the hospital, do they have the proper financial support or not, and do they have a proper family support or not. This kind of segmentation can also be applied, and we can the simplest way to do it is by putting a checklist and axis. So for example, the patient A here, she's checked in all of the variables in high severity, primary therapy, financial support, and family support. This means that this patient is also in the terminal stage. She's undergoing primary therapy. She has the proper financial support and the proper family support. Let's say the segmentation is segment A. And of course, the segment A is going to be different with the segment B, which is high severity, but he doesn't have any primary therapy, he doesn't have financial support, and he doesn't have family support, and so on and so forth for the patient C and patient D. They have different characteristics depending on the variables we already decided in the beginning. The segmentation actually plays a role or plays a part in determining the action for the nurses and the company. The patient A, because they have all of the support and all of the therapy, even though they have a high severity in their illness, the action should only be close monitoring, because right now the patient A is fulfilled. They have the therapy, they have the financial support, they have the family support. So we only need to monitor. However, the patient B, where is also high severity, but they don't have the primary therapy, they don't have financial support, they don't have family support, then here comes the data that we already collect. This means that a patient B or segment B is being listed as someone who needs an intervention from the nurse or from the organization. Of course, the action would be different for patient C or patient D. Patient C, even though they're similar with the patient B, they still have the primary therapy. That means that the patient C needs financial support and family support from the organization, while patient D doesn't have the high severity. The rest of them are in checklist, but the illness or the disease is not terminal yet. So the patient D are considered for dismissal by the organization. By segmenting the patient here, we can actually tailor the action that we are going to apply, or the action that the way we're going to serve them. Because of course, the patient who really needs intervention or really needs support needs more attention compared to the other patient. By doing this, we can tailor the attention or tailor the service we gave to them in order to make all of the segment of the patients feel more fulfilled, and the well-being score would be increased at the end of the session or at the end of the engagement period.
I see. Now I understand what Sean and also what you meant by combining those field observation and also combining the data. So it all comes about in consolidating the journey in order to make a decision. At the end of the day, we have patients, and all of those patients have different types of needs, and this is one of the ways that we can already have a method where we can take a really decisive action, and these actions will be it's not a one size fits all, because we will take the actions based on what they need. Very, very interesting. Now, if we talk about another point of view, you've talked about how you combine the medical information, medical data with the interviews, right? How about applying another lens, perhaps from demographic uh, and different types of informations that are not related to medical information?
Okay, so this is a very interesting question actually, because what we're experiencing today, like in the after the pandemic, the new normal, and COVID-19 and everything, uh, there's actually a lot of times where a pandemic or an epidemic happens in this world. One of it is cholera disease in UK, if I'm not mistaken, in Great Britain, but we will get to there later. What I'm trying to explain here is actually we can also apply demographic data to assist patients efficiently. For example, during this COVID-19 season, we can see that if we take a look at the Indonesia report on the disease, we see that, people in West Jakarta or people in West Java have the highest increase of cases, but also have the highest increase of discharged patients, something like that. And then there we can understand that if we are going to travel, we should avoid these area that are red zone, or a lot of people having the disease, or a lot of infected people. By applying the same concept to the palliative care, we can actually increase the efficiency for the healthcare service. So, for example, we have data for people in South Jakarta and in North Jakarta. We have their score. We have their well-being or overall feeling score at the top, and then we can see the symptoms they usually experience. For people in South Jakarta, we rank them from the highest score to the lowest score. So we see that, okay, the people in South Jakarta, the patients in South Jakarta have the overall well-being score is 7 out of 10, and the tiredness level is 3 out of 10, the lack of appetite is 3 out of 10, shortness of breath 2 out of 10, and so on and so forth, until the least experienced symptom is nausea. While in North Jakarta, they have different score and they have different order of the symptom. By doing this, we can see that, okay, so most of the patients who live in South Jakarta, their well-being score is quite good, but their top 2 symptoms they're currently feeling is tiredness and lack of appetite. While for people in North Jakarta, their top 2 symptoms are lack of appetite and the feeling of pain, wherever the pain might be. By using this lens, using the demographic lens, we can tailor our service to them. So, for example, if we get called from a patient in South Jakarta, even though they didn't say, I'm feeling this, I'm feeling that, and so on and so forth, we can prepare that. We can prepare ourselves to treat them for the tiredness and lack of appetite. So it's for North Jakarta. If we get called from a patient in North Jakarta, we can already prepare, before we go there, we can already prepare, okay, so the people in North Jakarta, patients in North Jakarta, somehow most of them feel more pain. The 2 highest symptoms is pain. So we have to go there with painkiller. So we have to bring painkiller with us. Whether we're going to use the painkiller later or not is a different matter. But the point is, by doing this, we can increase the efficiency. So if we go there and they actually ask for painkiller, we don't need to spend more time to ask for the painkiller, go find the painkiller and buy it. We already have it with us. Using this method, using this demographic data, we can assist the patients more efficiently.
I see. When you talk about that other case, right, where we go beyond the medical perspective, non-medical data, can you tell the example that actually has already been implemented way back then in England? You mentioned that, right?
Yeah. So when you ask about applying different lens in medical data, Tasha, but going beyond the medical data, I cannot lie that my the first case that came into my mind was this case in England. So back in England, there was a pandemic. There was a epidemic. There was a disease, but the disease was called cholera. Right now, we already know what cholera is. But at that time, in 18 something something, in 1800-ish, during the 18th, 19th century, where where the sanitation was not as good as today, a lot of people died of pandemic. They don't know what is causing it. The infection is spreading really, really crazy, and people died within 4 hours, within hours when they got admitted in the to the hospital, or at that time to the healthcare worker, right? What they have here is the name of the people, the time of death, what they did, and the location for their house, right? And then at that time they tried to think, okay, so is it because someone is eating poisonous food and someone is cooking poisonous food? But then they think that, okay, if someone is eating poisonous food, how come that it's only like clustered around these locations? And then is it some kind of virus or some kind of new kind of flu? But then they think, how come it's not everyone they meet got infected? It's only certain people who got infected, and then they died after that. And then there is this doctor named John Snow. So he was an engineer, but he's also a doctor, or have a degree in medical sector, in healthcare. And he was trying to see what happened. He tried going to hospital. He didn't find any answer. He tried to see whether it's airborne, or whether it's because of poisonous food, or someone cook up a bad food. He didn't find any answer. Finally, he took up a map. He took up a map of the London map back then, and he points people. He put a dot, the red dot here, represent where they live. So for example, John, if they live in the Marlborough Street here, he would draw a red dot here. And he draw a red dot for everyone who had died. Then he found out people who died actually live in a clustered area and close to the water source here, the blue fall. You can see here that actually a lot of people are grouped around the center of the blue fall. And there's also some people or some death here around this blue fall, and then around this blue fall. But there's no one who died who came from the other street, who is quite far from the blue fall. Then he thinks that maybe this is because of the water. So he went to this water source. He take a look at the water pump, and then he figured it's dirty. So he cleaned it, and after he cleaned all of the water source, the number of the people infected decreased. The number of death decreased. This is actually very useful when we try to do a preventive measure in the future, or the study that we often call the epidemiology, where we're trying to figure out how a disease can infect people. If we apply demographic data, if we apply another layer of data, or another layer of different perspective, we can actually figure out what is causing the disease. What can we do to stop them? John Snow here not only applied the medical information or the medical knowledge he has, he also applied the problem-solving skills by layering demographic data, and by doing so, he can understand what is spreading the infection, how to deal with it, and at the same time, he stopped the infection from spreading.
Wow. So it's really, really amazing how actually we can already have, by adding another layer here, we can actually improve the quality and also efficiency of how the service of the healthcare industry came about. So
Yes, correct.
if we can jump into the question and answer, right? very, very interesting question here. I would like to open the question and answer. So for those of you who wants to ask other questions and answer other questions, please put your questions in the Q&A panel so that I can mediate the questions to the panelists. So I want to open this first question to Sean. So Sean, you mentioned about the proxy where you can use data and construct it into making a well thought meaning. So the question is, are proxy and metric two different things?
So it can be the same things, but usually when we talk about metrics, it's already a very well-defined data or measurement for a specific purpose. For example, you can use revenue, profit, cost. Those are quite straightforward metrics to measure the company's performance. Or, if you even want to go even more specific, let's say you want to measure your market growth, or you want to see how well you are doing in sales, you don't really use profit, but you usually use revenue, right? And in this case, right, in the healthcare, metrics are, for example, the number of beds used, right, in hospitals. For the epidemic, for it can be seen as the number of people who got COVID-19, right? Those who are recovering, those who are, sadly passed away because of it, right? Or who are casualty of the COVID-19. Those are quite straightforward metrics, right? But when it comes to proxy, you're using a secondary data or data that is almost like, if it's like an assumption, if this goes up, that means this also improves, right? So in the case of healthcare, what we were using as a proxy was, in the palliative one, for example, is the more that the nurse spends time, right, the happier the patient, for example, right, or the better our service, right? It may not be a good proxy, right, but it's the best that we can find as a measurement, right? So it doesn't have to be perfect, but at least you're using a measurement to define whether your decision or your service or your hospital or whatever treatment you're giving is working or not, or is actually helping the patient or not, in terms of the welfare, right? Of course, when it comes to the medical, I think Sarah knows more about this than me when it comes to what actually works in the medical sense. Those are data that are quite, it's very scientific, right? But we're talking about the service, right, of the healthcare industry. So proxy is usually used a lot when it comes to services, customer satisfaction, right? Especially for the hospital.
Yeah. So even though we use proxy, Sean, it doesn't mean that we can rely 100% on one variables. That's why we also apply different lens in this analysis, right? We apply the data, the numbers that we know it is true, like the financial or the scores and so on and so forth. But we also we also confirm the idea and the concept that we have in mind by doing field visit.
Yep, exactly.
Thank you, Sean. Okay, so next question. I'm going to ask this question to Sarah, right? So during this COVID-19, how can we use data and analytics to improve the quality and efficiency in the healthcare industry?
Okay, so during this COVID-19 pandemic, why is it important to use data? Is because this is new. This virus is new. We have never experienced this before, the symptoms like, and then the treatment and so on and so forth. But the point is that currently the whole nation, the whole countries all around the world are trying to do their best in terms of data by at least tracking the numbers of the rising cases each day, and the number of people tested positive, the number of people admitted to the hospital, the number of people discharged from the hospital. It's all important. However, it is also important to keep in mind that the number should represent the population. So, for example, if you have 1 million population in one country, it doesn't make sense if we only test 10 people to make sure whether we still have the virus or not, to represent the whole country. We have to at least 10% is a bare minimum, basically. Like, it should be like around 25-30%, but it may be hard for a bigger population. But to be able to get a better glimpse of what is currently happening, we need to test as many people as possible. We need to make as many people as possible into our sample. Therefore, we can actually say whether the degree of severity in this country or in this area. So by using data and analytics and applying the concepts correctly, we can actually make a better regulation on how to deal with it. So if like for example, like the one happened in Korea, right? There was a time where they test a lot of people and then the degree of infection is really high and they stop all activity outside. They told people to stay inside. And after they keep tracking the same numbers. So the same 10,000 people, for example, they test again to take a look whether the virus is still there or not. When they see, okay, so the 10,000 people, which represent, for example, 50% of the population, all of them doesn't have any virus anymore. It's safe to go outside. So by using data and analytics, especially during times like this, it can actually help us to make a better regulation and make a better decision.
Thank you, Sarah. So again, a question for you regarding the healthcare industry, right? So what do you think is learning from the journey of this palliative care, especially the case study and healthcare industry in overall? What is actually the key takeaways that you learned that you think would be important for the healthcare industry in the future?
Okay, so the things that I learned from this case study, okay, so the first thing is that we should understand the journey of the healthcare. Why? Because as we already discussed before in the beginning that there are 4 journey, understanding the journey of the healthcare means that we can understand the purpose of doing such treatment or such care. Like, for example, the COVID-19, where we are currently in the stage of preventive. We want to prevent people from getting the disease, but at the same time, we want to cure. Therefore, by doing so, by understanding the journey of the healthcare, we can know what is the purpose of the problem solving that we're going to do or the decision making that we're going to do. The second one is that I think that we need to open the perspective of both the people who are not really in healthcare services and the people who are also in healthcare services, because as we know, health problem is not related to the health itself. Like right now, right? We see that COVID-19 is a health problem. Doctor needs to help people and so on and so forth. But then we can see that it's not that. It's not only that. The financial sector, the business, everything else is going down. The third one is to collaborate. The collaborate here means that apart from doing our best together to help each other, but it's also to combine the lens and perspective to solve the problem, like what happened in the palliative care case study or what happened with Jon Snow before. So apart from using the healthcare data, apart from only using the numbers of people infected and this and that, we should also collaborate with other sectors like businesses or demographic perspective, to take a demographic perspective or to take a financial perspective in order to better make decision and to solve the problem we're currently facing.
Thank you, Sarah. So another question for you. So we have a lot of interesting question here. So when you collect and also analyze the data, what kind of tools do you use and why?
Okay, so of course, all of you have heard a lot of tools like Python or maybe SAS or R and so on and so forth. Basically, all of the tools are a means for you to achieve your goals. So if your goal is only to see some simple analysis that can be done with Excel, then do it. Use Excel. But maybe some of you wants to have a bigger set of data, like billion people or 10,000 people, for example. Then if it's easier for you to do Python, then use Python. Or we have this thing we call in medical work to understand we usually use to do biostatistic, which we call SPSS. Then we can also use that. But during this case study in palliative care, we were using the Excel and PowerPoint to help us visualize the analysis.
Okay, thank you, Sarah. Now, one question. Okay, so we have already gone through the end of our journey here, but before we end this session, I would like to ask Sean for the last question, Sean. So you mentioned that you gathered a lot of data, right? And most of the data, of course, it should be analyzed further, and of course, it's not a clean, what we call a clean data, right? So how do you make sure that the data that you receive is useful?
Okay. So when it comes to data, I think this is applying for all kind of industry. Um, if we take the example of what I did with the palliative care, the most important part when it comes to data analytics is always the context, as well as the journey that people are experiencing or the business is experiencing, based on your observation as well as what you're seeing in the field. And it takes experience as well as your own creativity to actually make it useful. Sure, we have all of these knowledge when it comes to Python, when it comes to analyzing it with Excel, as well as using statistical methods. But those are usually tools to reach and analyze the data itself. But to putting the data into context requires more into the business knowledge or the industry knowledge that you have, so that you can understand what are you actually trying to solve and what are the key questions when it comes to solving a particular issue, right? And so in the healthcare or the palliative care one, what I did was that I went to the field. I talked with the nurses. I actually met with the patients. I looked at how did the patient and the nurses interact. And from there, I can then understand, okay, what are then the data that I need to look for and use when it comes to looking at how the nurses actually work, and whether we're improving the patient's life or not. So it's always all about the question and the context, rather than working with the data straight away. It's important to have a good question and to try and frame what are you trying to solving and why, before you go straight away, okay, give me the data and then I can make magic. So it doesn't really work like that. always start with a question and always start with observing on what is actually going on.
Wow, thank you very much, Sarah and also Sean, for sharing about the healthcare industry for tonight. It's been a really interesting session tonight. We've learned a lot about how we can improve the quality and efficiency of the healthcare industry. So I would like to end this session before we close. I would like to announce that the recording for tonight will be shared through your email along with the material. Thank you very much for joining this session tonight. We hope that it was useful for you and that you learned a lot of new things. We will have another webinar for next week, Tuesday, 7:30 p.m. And again, if you would like to build your credentials, please contact us if you would like to have the e-certificate for participation to info at houseofanalytics.com. Right, so thank you very much for joining this session tonight, everyone. We hope that this session is useful for you. Although you're not in the healthcare industry, we hope that this can bring you ideas and also insights that you can implement in your line of work. So thank you very much for joining this session tonight. Thank you very much, Sean, and also Sarah. We hope that for the next sessions, we can also learn different things from you guys. Thank you very much for tonight. So good night, everyone, and have a really good night. See you again next week, 7:30 p.m. We will send all of the invitations to you shortly within this week, so that you can also see what kind of webinar, the topics, and also who will be the guest speakers that we will be having for next week. So thank you. Have a very good night, everyone. Enjoy your
Thank you,
night.
everyone.
Thank you.